Welcome to the PUTTcast podcast by Pharmacists United for Truth and Transparency. Pharmacists United for Truth and Transparency is the only registered 501c3 nonprofit wholly dedicated to exposing the hard truths about pharmacy benefit managers and how their greed-centered profit-at-any-cost business practices are driving up drug prices and healthcare premiums while reducing consumer choice and endangering patient access. To learn more, visit our website at truthrx.org.
Hi, everyone. I'm Lauren Young. I am the Vice President of Pharmacists United for Truth and Transparency, and this is another episode of the PUTTcast. I am so glad I am joined today by our friends from Louisiana. We first have pharmacy legislative superstar Representative Michael Echols from the Louisiana House District number 14. Welcome to the show, Representative. Glad to have you.
Honored to be here.
And we have Matthew Cross from Louisiana Independent Pharmacists Association. We love our friends at LIPA and are always glad to partner with them and help support all of their great plans and initiatives, not only to impact pharmacies in Louisiana, but also serve as a roadmap for what other states are able to do across the country. So welcome, Matthew. Glad to have you too.
Awesome. Thank you, Lauren, for having us. We're super excited to be on and are appreciative and grateful as ever for our partnership with you guys as an organization, and everything that you guys are involved in around the country is inspiring, and it's really great for the advocacy goals and everything that we're working for.
Well, for those of you who have not had a chance to tune in and watch any of the legislative hearings over the past few years, our friends at Louisiana have been very busy. They are never one to shy away from going into the ring whenever it comes to pharmacy benefit managers and trying to stand up for independent pharmacies and patients across the country. Representative Echols, I know that you were one of the main supporters and advocates for this legislative session, and we'll get into House Bill 264 here in just a little bit. But for those of our listeners that have not had a chance to interact with you personally, can you give a little bit of your background, how you became a legislator, what really led you to become that pharmacy champion?
Sure. So before I was a state legislator, I was in the local city council for the city of Monroe, served there for a few years. And then, of course, I've been involved in my community in a lot of different ways through philanthropic organizations, social service organizations. Professionally, though, I worked for about 10 or 15 years for a multi-state health plan, a large physician hospital, also a hospital system, and we even had retail pharmacies. So I've seen some of the issues that are impacting the pharmacy, as well as with health plans that actually try to work with local pharmacists. So it has led me to be an advocate and a champion in a lot of ways for making sure our independent pharmacists, making sure that healthcare systems are aligned with the patient, and it's not aligned just to line the pockets of big corporations or even the health plan for that matter. So that's probably what's led me down the path of trying to make key reforms in many of the laws and bills that are out there as it relates to our pharmacists and our primary care doctors.
And so I know that a lot of push has been happening over the past couple years to make sure that PBM reform is bipartisan. And so I know that you as a legislator do work across the aisle and across chambers with many of your colleagues. I know that there are a lot of our members at PUT and other pharmacy owners across the country that have been interested in advocacy, and a lot of them have met with their legislators and talked about a lot of the issues that happen, whether it's at the pharmacy counter or other patients bring into them in a healthcare setting. Are there any strategies or any advice that you can give our listeners when they are talking to a legislator that might not have the healthcare adjacent experience that you had in your professional life?
I think a lot of the healthcare system has been designed to be complicated, so a lot of the schemes that happen do continue to happen. I think there was a lot we could do with both the transparency side of the house and making things as easy as opening your iPhone and making a phone call. Healthcare should be that simple. But as far as it relates to communicating with your legislators, I want to say thank you to our local and independent pharmacists in this situation. We've gone out and said, this is what's happening in my pharmacy. This is what's happening for me to not be able to serve that constituent that's your constituent that you should be out advocating for. So I think having those very, granular examples of why patients can't get access to their medicines or pharmacies have been going out of business, that there's an unfair system that's out there that's all been skewed and slanted towards those big PBMs, and even in some cases, the large national health plans that are fully integrated with those PBMs to not save money, but to extract money. And I think the message is getting louder and louder and clear. I think we're seeing it now with the Trump administration and some of the efforts that they're doing. So I think the wind now might be at your back to do things nationally and ensure that you align with what's going on at the national level from the administration's perspective and say, look, we just want to work with the Trump administration to provide transparency and clarity. And I think relating back to local stories, again, provide a lot of depth for legislators to understand this problem.
Absolutely. I wholeheartedly agree. I think that our legislators on the state level, they work very hard at trying to find solutions for their constituents. And so they have to be willing to step up and help legislators and agencies on the national level as well. That's the only way there's going to be any kind of reform that patients will be able to feel, just because there's so many different layers and plans and everything out there. So, and Matthew, LIPA does a great job of rallying the troops and getting the grassroots advocacy up there. I know there's other state associations across the country that look to LIPA, because when there is a pharmacy bill out and called for, your pharmacy owners come out in full force. You can see them at different press conferences, different hearings, showing support for their legislators who are taking up this mantle, because they have patients that come in every day that are unable to afford medication. Is there some secret sauce that LIPA has for their members that you're able to share with us?
So I don't know anything about necessarily a secret sauce, but I certainly would say that we have been blessed here at LIPA to have we call them active. Sometimes you can maybe say that they get a little bit rowdy. Group of pharmacies that are really focused and just active in their communities, but that activity in their communities and that involvement with their patients. As a community pharmacist, where you're serving the next door neighbors, your kids, coaches on their softball team and whatnot. They're all of the interconnectedness of the community that the pharmacy has, I think, pushes them to get out and to really speak up with their legislators. And just to kind of piggyback off of what Rep. Echols was saying, was it's important to realize and remember and recognize that legislators they're just people. It's really easy when you're not in this world and you're not dealing with them every single day. They can kind of put them up on a pedestal almost, and it's like, oh, well, I don't want to worry them or say the wrong thing. And it's like, look, a lot of them, like you're saying, if you don't have a healthcare focus and you're not really attentive to these issues already, it can be difficult to understand. And just to bring them into your store, that's one of the biggest things that we invite folks to do, especially new members of the association, is to bring your legislator into your store, just to be able to go through and explain to them what the problems that you're having, how the PBM practices, and just how all of these issues impact your workflow, but not just your workflow, how you treat your patients and your patients' care specifically. Because that's what a lot of the folks, they realize at the counters. They say, wait, this isn't just impacting your business. It's impacting the patient's ability to receive a necessary and important medication from their pharmacy.
Over the past few years, LIPA has really stepped up and answered the call whenever there has been issues. I know there's been previous legislation that you guys have supported over the past few years, whether it was from Senator Fred Mills or whether it was Representative LaVaugh. There's been a multitude of pharmacy champions. Is there a specific bill or a few bills that your members have really appreciated and said, this has been a game changer for us?
Yeah, well, and I think there's a few, and I'm grabbing my notes here just because I jotted a few down just to have beforehand. I mean, I think we've been fortunate, like I said, with our membership to have a very active and vocal membership, but then also to have legislators like Senator Fred Mills, who was a pharmacist and had that knowledge and was a very experienced and long-standing member of the legislature, to be able to have that connection with the other members, right? So there's a representative in the Louisiana House right now. His name is Representative Timmy Chasson. He is the only pharmacist that is currently a sitting member of the legislature. He was a very, very valuable asset to us, and just opened himself up to us to say, look, let me know, we can work on this, we can talk through these issues. And he began to kind of step into that role as a spokesperson or an additional spokesperson, in addition to what Representative Echols was doing and how he was informing people, because he had that knowledge as a pharmacist. And he would say, look, I mean, he never worked for an independent, but he spent time behind the counter for Walmart and was able to put his knowledge and experience out there and say, look, maybe this information that the PBMs are giving you is inaccurate, and this is more how it is in practice and what we actually see.
That's wonderful. We've been following what you guys have been doing at LIPA for a long time, and there are other states who are actively watching what you guys have done and trying to replicate different groundwork laws that you guys have put in place, because they know that your independent pharmacies really are helping make a difference at the legislative level. They are involved. They really want to be a resource for your legislators, and they really do try to make sure that the laws are going to help the patient. So Representative Echols, we are now at the part where we can talk about the House Bill 264. That was really the crown jewel of this legislative session. As I said before, there were people across the country that were watching what was going to be passed from this bill. A lot of pharmacy owners in other states have seen their legislators take more of a piecemeal approach. So whenever we saw all that was included in 264 and the fact that it was able to get across the finish line during this session was so incredible. I know that different states have taken different approaches to this. So if there's any specific pieces of 264 that you really want to highlight and talk about, I know that our listeners are very eager.
Yeah, so when we first started this process, and this is a complex process, moving a bill through both bodies, I've done work in PBM space in the last couple of years to try to provide more transparency, but getting to a comprehensive approach is something that I think is important. This bill started as more of a transparency bill, and then it grew through the process. When we moved this bill to the Senate, we worked with Senator Adam Bass, who is an absolute terrific champion, to upgrade this bill and work along with us hand in hand, as well as LIPA and so many other groups. We had everybody at the table discussing concepts and problems that we wanted to address in a comprehensive way. So House Bill 264 did things like payment fairness. When we start to see all the different clawbacks and all the other chaos that is caused by PBMs gouging our independent pharmacies, we had to put a stop to that, because it's not sustainable for our independent pharmacists to continue to take it on the chin again and again and again. Using enact pricing models, so we had a fair payment process that was transparent. We know the games that they play, when they're moving prices based on whatever they feel like today's price should be, and there's just no logic, rhyme, or reason. So putting rhyme and reason and fairness was something they thought was very, very important. Putting some definitions within the bill too, I think, was important, because they play games with words. So having a fair, open, transparent process, clear definitions, provides us not only price transparency, but what you get reimbursed transparency, which is fair, because at the end of the day, the patients are the ones that get the benefit of working with those independent pharmacists. The spread pricing issue and some of those abusive practices, effective rate pricing, these are things that we've always talked about, but we finally just said, okay, we're putting it all in the bill. We're going to make these corrections all at once. What I do know is that PBMs are pretty shifty when it comes to changing the game. My thoughts now are they've got 6 months. They know a lot of these rules take effect January 1st, 2026. So they're going to figure out how do we move the goalposts based on what this bill does. I'd like to come back in future years with stronger words and stronger and broader definitions of what rebates are. Because they're vertically integrated and they own not only their own pharmacies and retail stores and health plans and all these other service lines, they're able to siphon money out at every different level. My gut tells me if this reform passes in other states, they're just going to go out and try to buy pharmacy manufacturers, which they may already be. So we'll have to find new rules and regulations to stop that practice. Again, this is all just about getting back to fairness, so the patients don't continue to take it on the chin at a price perspective, and that the independent pharmacists don't continue to go out of business because of these malicious price practices where healthcare costs continue to go up in spite of all the work they're supposed to be doing to lower in cost.
I love the fact that you mentioned the different allies that you had, whether it was in the Senate, whether it was through LIPA. I know that in other states, there's been a lot of different people that have come through, whether it be different patient advocacy groups. I know that you talked about vertical integration. So there's also been kind of a push from the anti-monopoly advocacy groups as well that have been supportive of this, because they're seeing the egregious overreach that is happening in healthcare. And so those were some unexpected allies that we've kind of seen through this fight. Matthew, has there been anyone else that you've seen step up to the plate and help out through the process of these bills?
Yeah, I mean, I think we've seen a number of even the chain pharmacies. I mean, there's a number of different ones still in business in Louisiana. I know between the Walgreens and Walmarts of the world, and even some other grocery store chains. But I think that's what we've really started to notice over the last 5 or 6 years, really more so in the last 2 or 3, is more groups being willing to jump out there and say, hey, maybe this is something that we really need to get out in front of and push. Because I know that we've had the fortune and been able to lead the efforts in Louisiana here for the better part of the last 2 decades. And we always appreciate any assistance and help that we can get. And the last 5 or 6 years, we've really seen those really just general patient advocacy groups, like you said, come out, and also other chain pharmacies and pharmacy groups. Like I know one specifically was a hospital pharmacy group that came out and said, look, they really get us with the fees not only, but also effective rate pricing and spread pricing and all of that. It impacts not just the independents. And sometimes it's easy to get a little bit too focused in and on the independent pharmacy aspect. But if you start there, it kind of spider webs out, because we're not just talking about the independent pharmacy, because if that pharmacy is not viable and can't sustain to keep its doors open, they're not going to be able to serve the patients in that rural community that might not have a pharmacy within 30 to 40 miles of it. And we just see how in a state like Louisiana with our rural communities, how harmful that can really be and how that can impede the healthcare delivery for our citizens and elderly citizens specifically.
Absolutely. Well, we all know that some of the big opposition has come out in Louisiana. I know there was no lack of the people from PCMA that were really trying to make sure that this bill and other bills in Louisiana that were focusing on PBM reform were not going to pass. Representative Echols, whenever opposition comes up, I know that independent pharmacy owners really do feel like David in this fight against Goliath. So whenever you are sitting at a stakeholder meeting and you're sitting in these different conferences to talk about the bill going forward, and there's going to be opposition, and that some legislators know that this is going to be an uphill battle, has there been any opposition that you guys have been able to move to neutral, or is there any suggestions that you have for owners that just get so intimidated by the fact that they have to go up against Goliath?
PCMA and the PBMs are nothing more than lobbying arms for each other. And they're just there to protect the interest of their company. They have nothing to do with the patient's interest at the end of the day, because they're costing the patients billions of dollars. So I don't have a problem going up against the big guy because my job as a state legislator is to go down there and represent my constituents. So whether I get, skewered at the stake or we have a victory, I'm willing to fight no matter what the odds. I know Matthew knows that because I go up against all kinds of crazy different bills trying to solve problems for constituents and consumers. So this is, they spent hundreds of thousands, probably millions of dollars. They've got dozens of lobbyists in our state. CVS executed a horribly run PR and marketing campaign, which completely imploded on them through this process. They only put more wind behind our sails, and I'm thankful that they did what they did because, one, I think they committed a crime by using patient data and to communicate with them. So hopefully whatever fines they get will fill up our enforcement funds to be able to go with them in the future. And second, just to be able to put a national conversation and a statewide conversation all in check at the same time, they did us a huge favor. So whoever the executive was that made that call at CVS, thank you for making this a key issue. And I bet they don't work there anymore. But if they do, join us again next year for another episode.
It was the best episode of reality TV I could have ever watched. I watched hundreds of legislative hearings and press conferences and anything involving PBM reform every single year, and watching this unfold and watching the social media posts of patients showing the text messages that they were getting in real time while these PBM bills were being debated in Louisiana was just something that I never thought that we would see. And it's exactly what pharmacies see every day with patient steering letters and trying to really show them that these are tactics that are happening and harming patients. And the patient not having the choice of their pharmacy is so vital. They trust these independent pharmacy staff members. They come to them for so much more than just medication. One of the things.
Absolutely. And look, having the primary care doctor, the pharmacist, community pharmacist, and the patient talking, working together, it only drives healthcare costs down and increases quality. When you get nothing more than a sales organization that are trying to drive profits, it raises the cost of care. And so with this legislation, we should be able to lower the cost of care. Patients should not be concerned about all the heinous text messages that they get or crazy messages they get when they walk into a retail pharmacy like CVS. Those are just games.
100% agree. I know there were people that were watching the press conference with your Attorney General and Governor Landry, and they were so impressed by the fact that this was not going to be a topic that was shelved. This was something that was really going to be taken action. There has already been movements made towards that by your Attorney General, and it was just so wonderful to see that the PBMs were not going to be able to get away with their mafia-like tactics that we see on a daily basis. So HB 264 also mentions NADAC Plus as a reimbursement floor for local pharmacies. I know there's a lot of states looking at this as a possibility for their own PBM reform legislation. Representative Echols, can you discuss why this particular reimbursement model was chosen for this bill?
Sure. So having a national benchmark where you can have fair and transparent pricing models was included in the legislation for that purpose. I think that, simply by having that model, and there's so many other places where we don't have transparency in medical billing across the whole spectrum of the healthcare delivery system. I have fought for this in our workman's comp system. Health plans play games. We can't have a system where people can continue to manipulate the providers in one form or one fashion. So this is just simply a way for us to have a fair, level playing field. You look at some of the games that they set up between large health plans and PBMs, even down to the point of when you're going in and have a copay. And the copay may be set up and established to drive people to a more expensive brand medication versus a generic. I know the pharmacist is there to try to save the patient money, but the way they design a health plan is to push them to the more costly or more expensive plan, which drives up commercial premiums. So if it was up to me, we'd eliminate rebates completely. There's just so many games we got to clean up, and that's why we put some simple language in to create a fair, transparent process for being reimbursed with the pharmacist level.
I love your new transparent compensation model. I think this is going to be a gold standard going forward. I know that pharmacy owners are so sick and tired of seeing the rejection that comes through in their pharmacy system that says the patient's unable to get the generic, they must use the brand name. Otherwise, the plan will not pay for it. And that is a penalty for the patient, not a benefit. I love the fact that it's transparent compensation because sometimes whenever we're in the stakeholder meetings and they talk about reimbursement, there's not the discussion about there being a professional dispensing fee for the pharmacies. And so NADAC Plus is really that benchmark that you talked about that helps get pharmacies to that floor they need to be at in order to provide the service for patients. And so many other topics that we talk about with other legislators. And as you mentioned, you're an advocate for other commerce issues and patient issues and that are going on throughout your district. And so there's other small businesses that are feeling the pain whenever it comes to vertical integration, whether it be credit card processing fees or other things. And it's not our patients' fault that their insurance company is married to a PBM that is not wanting to pay us what they should be. So I think your transparent compensation model is the roadmap for what other states should be doing. And so hopefully they're looking at House Bill 264 to see how they can implement that. One of the other prongs of HB 264 that's important for us to talk about is the enforcement piece. I know that as a legislator, it is very hard to spend months of your time, even years, going through bills and then getting them passed, getting them actually to that goal line, getting it over the goal line, and then the enforcement piece is unable to be really implemented. So if you want to talk about some of the transparency requirements that this bill includes for PBMs, kind of the oversight and what you see as enforcement of HB 264 for our listeners.
Some of the things that I wanted to achieve was to ensure that the insurance commissioner had the ability to go back and audit books and look at the actual records, because that's the way a lot of these games are played. They just shuffle something off to a fee, don't relate it back to the actual transaction or the rebate or whatever dollars that they're shuffling in the system. So having a fair, open, transparent process where either the insurance commissioner or the attorney general can go out and do investigations, that they can pull records, and then if they find that somebody has violated one of the statutes or provisions of the law, that the attorney general could go out and fine them heavily, or work to fine them heavily, take them through a legal process, and that the damages be at least triple whatever the cause or infraction that they've created is, basically creating a treble damages situation. So there is an actual something of substance. When these guys are extracting billions of dollars out of the healthcare system, they don't mind stringing people along or paying lawyers to do games. At least this puts the attorney general with a large stick in charge of ensuring that these guys are do the right thing, or at least pay pharmacists responsibly.
Yes, I think we've found in other states that you cannot give them 1 centimeter of leeway, because the PBMs will take that and make that a huge loophole that then is unable to help patients and help pharmacies. And so I know that's very important. I know that in other states, whenever they've had legislation passed, sometimes the insurance commissioner or the Medicaid agency or the attorney general, they're not quite sure who it is that needs to have the oversight of this new law, especially whenever it's groundbreaking legislation. No one's quite sure where it goes. So typically we see studies and things like that happening in states so that they can have the data that backs up the claims that pharmacies have. And so I know that different stakeholders have really come to the table and tried to find out the best way that they can do this. Our friends in Arkansas and Oklahoma have had to move the jurisdiction over to the attorney general because there were so much pushback and changes were unable to be made in certain contracts through the insurance commissioner's office just because of how the PBMs and their attorneys were interpreting those contracts. And so, Matthew, if you want to talk about some of your members, I'm sure that your phone lines and emails are lighting up with members offering to be the security detail for the PBM advisory monitoring committee.
Yeah, I think it kind of tailing what Representative Echols was saying. A really, really strong piece that we're really glad and appreciative that was able to be included in the bill was independent authority for the Attorney General to investigate claims or any issues regarding this section of law. So, for years, this has really been an issue that's just been up to the Department of Insurance here in Louisiana, like a lot of other states. And the Department of Insurance has taken action and has really done a good job in some ways of enforcing those laws. But there have been some other issues that we're having, that differences in, like you said, interpretations of ERISA preemption, which is opening up a really big can of worms that we could talk about for quite some time. But just getting into those issues where we're not exactly sure, well, if it's a fully funded plan, we can do it. But if it's self-funded, we're not sure. And getting it over to have the Department of Insurance still have that ability, but have the Department of Justice and the Attorney General's office as a secondary with the full power granted to the Attorney General by the Louisiana Constitution behind her. That's really our goal. Our current Attorney General, Liz Murrill, has been awesome. She has been just as much of a champion as anyone has been for pharmacy benefit manager reform, and has taken it to them just as the same way that our now Governor Jeff Landry did as Attorney General prior to his moving into the governor's mansion. But yeah, it's been a long road. We're still filing tons of complaints. Our members we get, I think, at least 2 or 3 calls every single day with another claim reject where the pharmacy was unable to fill for 90 days or 30-day supply and was forced to go send it to the chain down the road or mail order. And even though that's a specific instance or action that is prohibited by HB 264. And there's been some confusion out there. Well, there are certain pieces of the law that do not go into effect until January 1, 26, but that's actually not one of them. That piece of the law is effective right now. And so we're filing complaints with the Department of Insurance on behalf of our member pharmacies every day on these issues. And we're working with them to try and make sure that they are held accountable and that the great laws passed by our lawmakers like Representative Echols are able to be enforced.
So I think we're coming to the end of our conversation. Representative Echols, if there is any parting wisdom that you could give us, I know you mentioned in a couple years you're hoping to have a little stronger language about rebates because we would all love to see that shell game go away. Just adds cost, adds the lack of transparency into this whole market. So if there's any advice that you have for our listeners or what we can look forward to seeing in more PBM reform issues so that we can continue supporting our friends in Louisiana, please let us know.
Yes, so I want to thank all the pharmacists that have been involved in this process. We had so many advocates that came to the Capitol, and they just stuck it out. This is not an easy process to go through. So accolades and thank yous to all those that toughed it out and were there every day calling and sending emails, and those that have just been right there at the forefront of looking at these changes and going, okay, finally we're here. But what I would also ask them to do is continue to organize and work with organizations like yours and with Matthews and everybody else to let us know what is going on the front lines. That industry, those big PBMs, the CVSs of the world are going to change their tactics and come up with another scheme because they're not about fairness in pricing. They're just about price gouging. If we can ever get a reformed group of PBMs, new PBMs and new models out there, I think we can put some of these bad practices to bed and then, have a system where it's fair to patients and that actually benefits the patient, the pharmacist, the primary care doctors, all working together as a team. So communicate. Let us know what you're seeing in the field, and we'll do everything we can to continue to bring innovation to this and try to make it fair for everybody that's involved.
Thank you so much, Representative Echols. That's wonderful advice. Making sure people are still getting involved, making sure that they know that even though House Bill 264 was able to be passed and cross the finish line, there is still work to be done, and they can look to our friends at LIPA and be their advocates for them. Matthew, is there any parting words that you wish to let our listeners know?
Yeah, I think really just to keep the fight. We've gotten a lot of increased attention and gained a lot of momentum over the last few years in the state here in Louisiana, but also nationally. We've seen a lot of attention coming from President Trump and his administration, from the 39 attorney generals that wrote to Congress to ask them to ban PBM vertical integration. We're seeing a lot of really great trends, and something here at LIPA that we've really tried to hone and focus in on over the last, I think, 3 or 4 years is 2 very specific and dumbed down, simplified mission statements. And it's one that every patient have access to their prescription drug, therapy, healthcare, whatever it is, from the pharmacy of their choice, and that that pharmacy be paid to at least cover the cost to acquire and dispense that drug, period. And so that's really when we look forward to, okay, like Representative Echols was saying, we're not necessarily done with enact Plus. We understand that doesn't cover their cost alone and that it has to be with some sort of percentage markup and a professional dispensing fee. So when we come back, that's really what we're looking to ensure at the end of the day for Louisiana, is those 2 key points.
Well, thank you both for all of your time today. Congratulations to all of our friends in Louisiana that were able to support House Bill 264 and all of the PBM reform initiatives across Louisiana this session and for the past few years. We are watching across the country. There are LIPA fans and Representative Echols fans that we have found on social media, and they are just so appreciative that there are people listening. There are people that are willing to take on this fight and challenge the PBMs in order to help patients have access to affordable medication and to help small business owners, independent pharmacy owners continue their own fight. So thank you both for all that you have done. We look forward to many more successes coming from all of our friends in Louisiana, and we look forward to having more conversations celebrating more wins. So have a great rest of your day. Thank you for joining us for this episode of the PUTTcast. If you don't know us, we are from Pharmacists United for Truth and Transparency, or PUTT, and you can join us at truthrx.org, and you can get a multitude of different resources. You can sign up for our newsletters. You can follow us on social media. You can really get a wealth of information from all of our outlets. You can also donate to our cause at truthrx.org/donate. We appreciate your time today, and hopefully you'll join us for the next episode of the podcast.
PBMs are robbing you day in and day out, making you work for below-cost reimbursements. Billion-dollar corporations hurting hard-working independent pharmacy owners as they line their pockets and put so many of you out of business. And now it's happening with so many pharmacy software vendors that have sold out to billion-dollar hedge funds. Are you truly happy with your pharmacy software vendor? Is support what it used to be, or you find yourself waiting on hold? Are your issues resolved in a timely fashion? When is the last time you took a look at the bill from your pharmacy software vendor? Perhaps it's time for a change. Visit our website at www.datascanpharmacy.com and give us a call at 1-877-222-7979.